Hi there, I'm Kath. I'm a registered dietitian from South Africa, but for the last 2 years, the UK has been my adopted homeland. When I first got to London, I got drawn into the corporate world of selling nutraceuticals, and although I had got a lot of business-based experience, I recently decided to go back into the hospital setting. But in order to do so, I needed to update my skill sets, and that's really where the Health Sciences Academy came in. Um, I'd never done any online studying before. Found the options quite overwhelming, and at the end of the day, you're never really sure what the return of investment is going to be as far as the money you put in and the knowledge you take out. But I'm more than happy to say that the HSA really did supersede all expectations. A key point of choosing HSA at the beginning was that they offer CPD and CYQ accredited courses, which those acronyms really for me stand for competence and credibility, two of which are crucial to actually translate into the business or the therapeutic sense. So you are getting world recognized qualifications to either kickstart your career or to just add value to your existing profession. Um, in order to put the learnings into practice, I also really needed to make sure that the information was science driven. And, for most of us, trying to track down reliable research is rather limiting, not to mention time consuming and exhausting. So, luckily for us, the HSA review all sorts of publications, and they basically summarize the key findings in throughout the course modules. And if there is something that you would like to learn a little bit more about and investigate further, then the HSA really do open up their extensive research database to all by creating links for full articles and adding suggested readings there as well, which I thought was really good. Um, for some of us needing a few added extras as far as making the learning dynamic, then the HSA doesn't disappoint as the courses are extremely interactive. Uh, they contain videos, polls, end of module quizzes. Um, so really you keeping on top of the knowledge as you progress and recap as you go. And I think that for me, as far as the little discipline aspect is concerned, was also extremely helpful. Um, I recently completed the clinical weight loss certification, and I have to say this has added extreme value to my degree. To be honest, there were certain areas of research that we didn't even cover in university. Um, for me, it was fascinating to really delve deeper into the food industry and see how they have affected the obesity epidemic over the last 30 to 40 years. Um, as far as food production goes, to changes in marketing, profit optimization, as well as lobbying tactics. So that was really interesting for me to come to grips with that and see how that in turn is affecting the patients I will be dealing with, and how I can kind of combine my knowledge with reality and make it easier for success as far as nutritional intervention plans are concerned. There was also groundbreaking research made available with regards to food addiction, and that basically focuses on how certain foods and chemicals actually do trigger certain parts of your brain that lead to overconsumption and a greater conversion of food to fat mass. And I think understanding that has also been extremely helpful for me as far as applying it going forwards. Um, the knowledge that these courses provide really can be applicable for your own life or in your profession, whether that be in fitness, as a nutrition consultant, and even other healthcare professions where nutritional understanding might take a bit of a backseat to other areas of expertise. So, when you think about it, GPs, for example, they generally are the first line of contact for the general public, and I feel as though these courses from the Health Sciences Academy would actually strengthen holistic care by allowing more and more medical experts to provide nutritional interventions to patients when they are maybe pre-disease or at early stages of disease, and that in turn could actually reduce the need for prescribing medications to actually combat symptoms that often result as through disease progression. I mean, when you think about most diseases, chronic disease of lifestyle, including obesity, and a lot of other non-communicable diseases, the two key risk factors is a unhealthy diet and inactivity. So for me, it makes sense that having an understanding of these two things should be at the forefront of all preventative healthcare, as well as the baseline for even like public health policies. So the clinical weight loss certification was just the beginning for me. I intend to plow my way through most of the other courses, if not all, starting off with the food allergy and intolerances course and then progressing to the dietary supplements advisor course. And while I keep my brain active, I'd just like to wish you all the best with your studies and successes. Okay, well, take care and all the best. Bye.